Hi, everyone. Welcome and thank you for joining us for our June episode of Chain Reaction. My name is Taylor Young, and I am the Assistant Director of the National Keratoconus Foundation. We are a patient advocacy program based in Southern California at the University of California, Irvine. NKCF provides information to patients and their families and raises public awareness of this cornea disease. We invite you to visit our website, nkcf.org, and sign up for our newsletter and to register for our bi-monthly webinars. We also post news on our Instagram, LinkedIn, and Facebook pages. This is episode 15 of Chang Reaction, our Ask the Expert podcast. Our partner is Dr. Clark Chang, a noted keratoconus expert and friend of NKCF. We often receive questions about life with keratoconus, and Dr. Chang has offered to share his advice on these questions. You can view past episodes by going to nkcf.org/webinars. Dr. Chang is currently the Director of Specialty Contact Lenses on the Cornea Service at Wills Eye Hospital in Philadelphia. He is also a member of the Medical Affairs team at Glaukos, the company that makes the FDA-approved cross-linking product and equipment. He is a graduate of the Pennsylvania College of Optometry and a fellow of the American Academy of Optometry. Dr. Chang was also named the NKCF Top Doc in 2020. We also have a special guest with us today, Dr. Kevin Feng. Dr. Feng grew up in Long Island, New York. He attended Massachusetts College of Pharmacy and Health Sciences University, where he did a 7-year combined Bachelor of Science in Pre-Medical Health Studies and Doctor of Optometry degree. His passion is fitting specialty contact lenses on patients with keratoconus because in every case he has had, there was a lasting impact on him. Welcome, Dr. Chang and Dr. Feng.
Thank you, Taylor.
Thank you, Taylor.
I want to first thank Dr. Chang. A huge thank you to Dr. Chang for having me on Chain Reactions. It's truly an honor to be here. Today I'll be just answering questions, the most asked questions I get from my residency.
Yeah, no, thank you for the intro, Taylor, and thank you for that as well, Dr. Fan. I'm sure that our listeners are going to benefit greatly from your presentation. And so let me just say a little bit about the fact that Dr. Fan and I have I've had the fortune to, work with him in the last few months in our cornea service at Wills Eye as well. So I certainly know what he's capable of, and he's, going to be doing a lot of good for a lot of our keratoconus patients out there. And he is kind enough to, have provided to share his residency training experience a little bit later on in this episode, which I'm really excited about, as well as giving us a list of common questions that he gets asked all the time, because I feel like very strongly that number one, we got really good, our episodes, the ones that we had interviews with our special guests are always very popular. And so I wanted to kind of do more of that for our listeners. But also I think just that feeling of knowing what questions that other keratoconus patients are asking is very important for a lot of our own keratoconus patients. We may all be being taken care of by different eye doctors, but it certainly feels that sense of solidarity when you know that you're not the only one thinking about that question, which is the sort of inspiration behind this episode of answering the most common questions that Dr. Fan have been asked in the last year during his residency. So I think without further ado, Dr. Fan, are you ready?
Yes, I'm ready.
Perfect. So, question number one that Dr. Fan gets asked a lot is, why can't I wear glasses or soft contact lenses, but instead have to wear hard lenses? What would you say to that, Dr. Fan?
This is a great question. This is a common question I get every day in my practice. Before I address this question, I want to first quickly talk about what keratoconus is. I know Dr. Chang has talked extensively about keratoconus and what it is, but I just want to give you my take. As you can see on the photo I have on this slide, on the left-hand side, you have a picture of a normal cornea, and on the right, you have a cornea from a keratoconus patient. Cornea is the clear window into our eye. And for normal patients, this clear window is a nice curved surface. So when light enters the eye, it tends to focus on one point on the back of the retina, allowing you to see clearly. But for keratoconus, there is changes to the cornea itself. The cornea begins to thin, and because it thins, it weakens, and it tends to bulge forward, forming a shape of a cone. Because of this, when light enters, it will scatter, and it won't form a perfect focus on the retina. Most of the common symptoms patients will complain of are blurry vision, glare, halo around lights, and just a sense of not being able to see well in their glasses or soft contact lenses, even with many different remakes. So this is what I was talking about. This is a picture of a normal cornea. When light enters, perfectly focuses on the back of our eye. This is a keratoconic cornea, cornea that is changed to have a shape of a cone. So when light enters, the light doesn't focus on one point, but it scatters on the back of our eye. So why can't we wear glasses or soft contact lenses instead of hard lenses? So when we wear a pair of glasses in front of our eyes, even with the best pair of glasses, light will enter, pass through the pair of glasses and still hit a distorted shape of the cornea, causing the light to focus imperfectly in the back of our eye. Soft contact lenses are the same thing. Because of the material of the lens, it tends to drape and actually mold to this shape of the cornea. Because of this, when light comes in, it's still going to hit a distorted lens and a cornea, causing the light to not focus perfectly in the back of our eye.
And actually, Taylor, before we go to the next slide, would you mind backing up one more time? So if you could help me just and help Dr. Feng, he was kind enough to give us all these useful images, but patients may not know. So with the cursor, if you wouldn't mind just circling where the keratoconus cornea is, there you go, and that's where the light are being bent. And then if you could circle, now move all the way to the back where the retina is. So that's where we would like the best focus to occur. But as you can see, and Taylor, if you could do one more, where the light is currently being sort of focused right in front of there you go. So that is where the distance where the image is being focused, as Dr. Feng has just described, but as everybody could see, you'll see that that point of focus is far away from the retina, as it actually, if you follow the light ray when it gets to the retina, in a very simplistic illustration, it actually splits into 3 different point of lights, which later on you actually see a simulation from Dr. Feng's patient that shows you like 3 sets of everything that patients are seeing, and much more washed out in terms of the color contrast. And that's just, again, a very simple illustration. In real life, the interference and the noise level is actually exponentially greater with keratoconus because of different points that people are looking out of. So I just want to kind of set that scenario before Dr. Feng goes on and explain the contact lens application. Sorry, Dr. Feng, for the interjection. Let's go into the next slide now.
Yep, thank you. In this slide, we'll be talking about the hard contact lens and why it does work for patients with keratoconus. A hard lens, unlike the soft lens, will not change the shape when it's placed on the eye. The added benefit of a hard lens on a keratoconus eye is that it actually sits on a layer of tears, and this tears will actually neutralize any irregularities of the cornea. All right, as you can see on this photo, you have a hard lens that is sitting on top of a layer of tears on the cornea. The layer of tears, like I said, is very important because it tends to neutralize any irregularities of the cornea. So when the light comes in, as you can see, it comes to one perfect focus on the back of your eye. This will help patients with keratoconus improve vision and help with their symptoms of glare and halos at night. I usually tell my patients wearing a contact lens is like having a transplant without having the transplant.
Yeah, no, I think that's a great analogy, Dr. Feng, and I especially like the emphasis to our patient, or at least the instruction to our patient that, and I know later on we're going to get into it, it's not just about improvement in clarity, and there's many different aspects to one's visual function, and halo and glare is one layer of interference that we also, as much as we can correct it, we'd like to focus on and be able to improve patients' quality of life. So I love that that you do educate your patients on that. Okay, so now we're at question number 2, and I will concur with Dr. Feng that I'm actually not surprised that he gets this a lot because it's about practicality, right? It's one thing improving patients' vision, but it serves no purpose if they could not operate with the lens. So the question comes up very often then, Dr. Feng, how do you answer to patients when they say, I have trouble putting my lenses on, I practice a lot, what do I do now?
I tell my patients, definitely don't worry. I know you tried your best, but we have many tools in the toolbox. So if this tool doesn't work, we can find another tool that can work well for you. So inserting a scleral lens is definitely very difficult to do. The technique is definitely steeper compared to other fitting and techniques with the other contact lenses. As you can see the pictures I have here, with scleral lens insertion, you are required to have a plunger to insert the lens, a plunger to take out the lens, and many different fillings, salines to insert before, put on the bowl before you put it into the lens. Also requires you to lean over, tuck your chin in, and put the lens on without forming a bubble. So understandably, this is definitely a much harder technique to do. So these are the other tools we have in our toolbox. On the right, you have a scleral lens. On the left, you have a corneal gas permeable lens, which is a smaller hard lens. And in the middle, you have a hybrid lens. A hybrid lens has that benefit of the GP, the hard lens optics, the vision, however, with a soft skirt, a soft surrounding around it. For my patients who are having trouble with insertions of scleral lenses, I often recommend trying a gas permeable lens, the one on the left. As you can see, it's significantly smaller and the insertion technique is significantly easier to do compared to a scleral lens. You don't have to use plungers, you don't have to have a filling saline, and also you don't have to, best of all, you don't have to lean over, tuck your chin in, and put it in without a bubble. So this is what I usually recommend. Also, it's a great lens, especially for patients who are new to contact lens wear or never had something in their eye before, or just patients who have a very strong blink reflex, especially when you have a finger coming towards their eye, they tend to like look away or squeeze their eyes really hard. So I usually have my patients who are having trouble with insertion wear the corneal gas permeable lens for at least a year. And after a year, we can reassess if they're feeling more comfortable, if they're having a much better time holding their eyelids and getting used to something getting close to their eye. We definitely will try a scleral again. I sometimes have patients who come back to me and say, hey, like before a year, say that, oh yeah, I definitely can do this. I think I can do this pretty well. And yeah, and then we will start using the scleral lens then.
Yeah, I love that, Dr. Fan. I have to say, I love that technique of, and I know you and I do the same thing in terms of our way of thinking, and that is we really have to fit the patient at the moment, and sometimes they're not just beyond their eyes, but also their whole person, but their lifestyle, take that into consideration, their ability to handle the lens at that moment, which gets better with time. But as well as even sometimes their disease state, right? As their disease state changes, that also then would, would bring about sometimes the need to change the fitting characteristic of that lens, which is, more complicated. And I think sometimes patients can, foresee or understand. So definitely a lot of hard work from you to be able to rehabilitate your patient as well as I know that they are doing. So yeah, I concur that that's a really good way of looking at things, and that may answer some of the questions of patients thinking, why are my lenses changing, but my eye is not getting worse? And again, that could be because there are a lot of other factors that goes into the calculation of knowing how to fit or be able to kind of fit the lens the best possible for the moment that that the patient is in or the upcoming year or two. So we're on a roll here. Question number 3, which again, sort of continuation of the theme of practicality, right? Because it's one thing of being able to have a great lens fit on you that fits really well and ensures long-term health. And then, it's one thing that a patient could actually put the lens on, take the lens off, and be comfortable all day long. But then there's also another aspect where patients may be told that he or she is doing great because in a clinical testing environment, they're reading what we think is a really good number like 20/20, but then they come back and ask you, Dr. Fan, and say, but I still see 2 of everything, or maybe even 3 sets of everything. Would that go away? Is that normal? What should I do now? What's your question? What's your answer to that?
Yep, great question. So I actually been getting more patients that are reporting to me that even though they see pretty well, that they're unhappy with the quality of vision. So that is why during my clinical examinations now, not only am I checking the visual vision and entering into my chart to track any progression with the keratoconus, but I'm also asking what the quality of vision. And I'm finding that there are a good portion of patients that are unsatisfied even with a well-fitted lens that they can wear all day long and they're seeing well on the chart in the exam room. The picture below is what some patients with keratoconus may experience. This is what we call ghosting and shadowing. You're most likely experiencing this ghosting and shadowing from increased noise, what we quote unquote noise in your visual system. There's a really good research article I refer back quite often, and it says that patients with keratoconus tend to have 5.5 times more noise compared to a normal patient. Most patients with scleral lenses, most patients with keratoconus, sorry, wear scleral lenses to improve their vision. Scleral lenses are really well tolerated, and they do get rid of some of this noise that patients do experience. However, there's times where these scleral lenses do not correct all the noise per se. So there has been a machine that came out a couple of years ago that do correct for this noise, and we just create noise, what we call noise canceling scleral lenses for our patient. And this is the machine I have in clinic. So here I just have a quick video to demonstrate this piece of machinery. This is me in my clinic doing a scan on a student. As you can see here, this machine takes about 5 scans in a couple seconds and measures all the noise that is present in your visual system. And once we get this data, it actually transfers to the computer, and from there we can actually send it over to the folks that makes this machinery. And from there, they will actually talk to the lab manufacturer and actually create a very customizable noise canceling scleral lens for you. This picture is provided from the company itself. It's a great picture to educate my patient what is actually happening. As you can see on the top right, that's a letter E. That's a letter E without any ghosting and shadowing. That is usually what a normal patient usually sees day to day. I will quickly demonstrate a case I recently did on a patient. She complained to me of increased ghosting and shadowing, especially when she was reading and writing. As you can see, I did a scan to measure the amount of noise that she had in her visual system. And on the left, you can see the E is really distorted. This is without the noise canceling lens. And once we were able to make a noise canceling lens for her, we did a scan on top of that lens. As you can see, the E starts to come to focus. We were able to correct a lot of her noise in her system, not all of it, but she was ecstatic. She reports that she could do all the things that she was having trouble with before, and she absolutely loved what we were able to offer her. This type of technology is still relatively new. Not all practitioners would have it, so don't worry if you reach out to your practitioner, because it's still getting out there.
Yeah, and I agree with you, Dr. Feng, that it's certainly not a commonplace. It takes a lot of attention, such as I know you're capable of, in being able to kind of figure out what noise to cancel and what not to, and then see the patients through. It does tend to involve longer follow-up. So I certainly think that, patients need to understand that while there's no perfection, and we want to, reach a perfect solution for our patients, but nothing's really perfect and it's not just keratoconus, any type of corneal etiology that leads to that, a lot more noise in the visual system can sort of fall in the same category where maybe nothing's perfect, but what is the best solution that we can come up with? And I also wanted to just say, secondly, I really do love the visual stimulation that you're showing us, because in the image under the noise canceling lens that you're showing us, I want everybody to take a very quick look. It's still not the same sort of perfect E that, and we use E because that's the letter that everybody can, knows is on the top of the chart. So it's easy to demonstrate. But you see how this Dr. Feng's patient is really happy and not reporting anymore, at least not that she could notice. with ghosting, halo, star bursting at night, but yet the computer simulation is still showing there's some amount of it. And what that amounts to is the fact that your brain can tune certain level of noise out. I call that neuroadaptation. And I've mentioned it a few times in prior episodes. So it shows you that you don't have to get to like a crisp image in order for your brain to tune it out. You just need to get very close. And I think that's part of the struggle that patients don't understand is that, oh, it's great. Let's say that, if I play the Dr. Fen's patient in this case and say, oh, this is this is the best I've ever seen, but I still see a little bit of, say, ghosting or doubling because just like the image the computer is showing, understand that that may actually neuroadapt and go away if you just have some patience to kind of hang in there with Dr. Fan. So, and I hope Dr. Fan, I don't know if you found that to be true. So certainly I think there's a lot of patience that needs to kind of go into creating such a complicated lens and being able to gauge patient responses.
That's a great point, Dr. Chang. I actually had a patient that had similar experience. After I made the noise canceling lens for her, she reported that, yeah, she wasn't seeing much improvement or very little improvement, and she wasn't really ecstatic about the process that we were taking her through. I told her, hey, like, give it a month off, come back, we'll see how you are. Try to wear every single day. Try to tend to ignore what's going on. And in a month, she comes back and she was ecstatic. Nothing's changed. We didn't make any fitting changes, vision changes with the lenses. She was able to neuro adapt, I would say, like you said, to the new optics of the lens.
Yeah, so I think, again, just something to kind of take away for our listeners. So next question, again, we're a lot of excellent questions that Dr. Fan has been generous to give us his time. So just a few more, hang in there, Dr. Fan. Question number 4. Do contact lenses cure or stop my keratoconus? And I can't tell you, Dr. Van, this is such an excellent question. Thank you for putting this on the list. Cannot tell you how many times I've heard that as a question from my patients. So I'm eager to hear your answer.
Yeah, so it's a question I also get a lot. The answer is no, unfortunately. Contact lenses do not cure or stop the keratoconus. It is still very important for you after you've been appropriately fitted in contact lenses, meaning that you are having good comfort all day long, you're able to see pretty well, is to follow up closely with your eye care practitioner either every 6 to 12 months. It is well known in the literature that keratoconus tends to progress the most before and after puberty towards the age of 40. And we have seen that some patients, even after the age of 40, tends to progress. So it's very important that you follow closely with your eye care practitioner. They will do all the appropriate tests just to manage your keratoconus. And yeah, if there is progression of your keratoconus, there is actually a FDA approved procedure in 2016 to stop the progression of keratoconus. This is what we call epithelium off collagen cross-linking.
Which I believe we have a photo in the next slide. Is that correct?
Yes, we do. Yep.
Oh, there you go.
This is a patient undergoing that corneal cross-linking procedure. I get a question also very asked to me often is, what is collagen cross-linking? And what I tell them is that it is the only FDA-approved procedure to stop keratoconus at this standpoint. We have found that in elderly patients, their corneas tend to be stiffer because of the natural UV light they have been exposed to from the sun throughout their lifetime. Because of this UV exposure, their corneas tend to be stiffer. So when doing this procedure, the goal is to prematurely stiffen your cornea by shining high amounts of UV light. That's what the patient in the picture is undergoing right now. It can help stiffen the cornea, stop the progression, and it has been deemed to be very effective and safe procedure for many patients.
That's great. Thank you, Dr. Fan. I do want to quickly also point out, just for our conversation and those who are listening, of course, what Dr. Fan had mentioned about your tissue changes with time, we call that age-associated cross-linking. It's a very slow process. And there are different ways that it could occur, that it's not completely UV exposure. So I just want to kind of make that clear. I don't want people to not go out and sunbathe without any protection to their eyes, because we mentioned that UV exposure is one way. There are other very slow process that does occur in your body that leads to cross-linking, but that's too slow a process to be helping patients who are currently experiencing progression of their keratoconus, which is why this is the treatment option that Dr. Feng had discussed and usually discussed with his patients. So if we go to question number 5, we're wrapping up to the end. Again, 4 excellent questions that I hope our viewers echoes with our viewers, because I am very sure most of them at one point have been thinking about those questions, and maybe even currently you're thinking about those questions, and now that they're answered by Dr. Feng. So Dr. Feng, with the depth of the knowledge that you've shown, tell us why you decide to do a specialty contact lens residency, because is it still true that the estimation is about maybe less than 10% maybe of doctors actually decide to do this 1 extra year of residency training? And so why did you do it if so few people decide to do it?
Yeah, definitely. I heard that number before in the past about the amount of the percentage of my class that underwent a residency. I felt like for my class, because of COVID, more of us wanted to pursue a residency. Really, for me, to pursue a residency in specialty contact lenses was when I completed all my contact lens rotation as a 4th year student. It was really during these rotations I realized the tremendous impact especially contact lenses had on not only to improve one's vision, but as a mean to improve their livelihood. I had a couple patients come in who were newly diagnosed with keratoconus and never wore a hard contact lens before, and didn't even know that their condition could have been really improved with especially contact lenses. When I was able to appropriately put a lens on, they started crying. I had a handful of cases where patients would just cry for 5 to 10 minutes and just telling me how life-changing this lens would be for them. Also, I have other patients who have come to me saying that, yeah, like once we were able to put the lens on, they're so happy to be able to drive again, have freedom, because a lot of these patients would come with a significant other or family member, and having that freedom again, being able to do their own groceries, being able to go to the movies, being able to do things by themselves was really life-changing. And this is what really drove me to do a residency in specialty contact lenses.
That's great. So thank you for showing us your commitment in, making our patients better. Certainly, this is an area that you and I both know is not commonly specialized within our colleagues. And again, thank you for the passionate plea to possibly you and I can, with this episode, go on and inspire more upcoming doctors who would want to follow your steps and then, go in and specialize with specialty lenses by doing an extra training time in specialty lens kind of residency. I think I snuck in one more question here because I'm personally curious before we leave this episode, which we've learned so much, but let's learn a little more about you, Dr. Feng, before we go. So what are your plans after this year of residency? What are you going to do?
Yeah, it's my year of residency was only a year, but I can't believe how fast this year has really flown by. After my residency in July, I'll be working at a private practice in Princeton, New Jersey. Here, I'll be working alongside other ophthalmologists and optometrists, but my main focus will be fitting specialty contact lenses on patients with keratoconus and other corneal disease. I'm extremely excited about this opportunity to work alongside great doctors. Being able to learn, being able to continue to grow is why I decided to challenge myself by joining this practice. I want to provide the best care I can for my patients. Other things I want to do post-residency is being able to travel the country, explore new cities, try new food, go on hikes around the country. Lastly, I can't wait to play basketball again. Just a sport I did growing up, played with a lot of my buddies, and it would just be great just to be able to not only study all day as I did for the past 9 years, but be able to enjoy a sport I loved growing up. So.
Thank you so much for being our special guest today. Again, just lots of learning that I'm sure our audience had benefited from. And I'd like to throw the mic back to Taylor.
Thank you both so much. That was really helpful to learn more about contact lenses for our keratoconus patients, and very interesting to learn about your experience in residency, Dr. Feng. So thank you for joining us today. So next month, join us for another episode. New episodes drop on the 1st of every month, and you can find them on our website, nkcf.org/webinars. If anyone listening has a question that they would like answered in an upcoming episode, you can submit it at the NKCF website under the For Patients tab. You'll go to For Patients, then Ask the Expert chain reaction, and we'll try to answer it in an upcoming episode. And finally, NKCF operates with the support of friends and donors. If you feel the urge to support us, you can make a much appreciated online gift to the UCI Foundation. In closing, I just again want to thank you both for joining us today and answering questions and just shedding light on more keratoconus topics. Thank you both very much.
Thank you.
Thank you.
Bye, everyone.
Bye, everyone. See you next month.